here today with the SDS team. As Donna said, I was previously a member of the self-directed support team for a couple of years and helped with the development of the SDS framework as standards. So I may be familiar to some of you, but I moved into my new role in September of last year as the Digital Social Work Policy and Practice Advisor. I've got some slides. Calum, can you share them on the screen, please? Fab, thank you, Calum. So as I said, my name is Calum Campbell. I am the Digital Social Work Policy and Practice Advisor within Social Work Scotland. Very honoured to be here today, and I'm particularly happy, as Donna said, with digital being included as a golden thread within the SDS improvement plan. I think that's really, really important, and I think it's good timing that I'm here today to have the conversation with you. Just as a quick bit of background, I am a qualified social worker, having had experience of both children and adult services in local authority and third sector settings. And crucially, when I worked in the third sector, I had experience of using digital technology within social work practice. This was in 2017, so pre-pandemic, and it felt really quite exciting and innovative to be using WhatsApp and to doing video calls and to be using a live chat platform so people could speak directly to social work on our website. So it's really nice that we in local authority, statutory services, we sometimes feel that we're a little bit behind the curve. So it's good that we're having these conversations now. And as Donna said, for today, I'm going to talk about digital innovations within social work and social care. And there's a real cross-cut, obviously, into health too. I'm aware that I'm not just speaking to a room of social workers, but I know I'm speaking to people. I know there are a lot of social workers here, but I know I'm also speaking to people who work closely with social work and support social workers. So a lot of my conversation I may talk about social work quite a lot, but please know I also mean social care and health to some aspects too. I know that in your work streams as part of this community practice, you're starting to consider digital innovations. And as I said, I'm really excited to be here to maybe help with some of that thinking. But I really want to lay this out at the start. I'm acutely aware of the pressures that social work and social care are under. And I really want to emphasize from the start that digital social work is not something new. It's not something extra. It's about using digital technology within social work, not to replace professionals, but about supporting their work. So it's crucially about being more flexible, agile, working a bit more quickly, really meeting people's needs in the best way that suits them. So I want you just to stop and pause and think about technology and digital and social work and maybe what comes to mind. And Callum, if you jump to the next slide, please. Do you start to think about electronic case management systems, smartphones, video calling platforms such as Near Me, which we're seeing more and more use of within social care? Or maybe you start to think about data, surveillance, artificial intelligence, androids, robots. Of course, digital technology in social work is complex and it covers really all of that, if I'm honest. But in reality, it can be really simple too. I think too often people might think technology use in social work is separate from the normal social work, and I'm here to say it isn't. Social technology within social work isn't the future, it's now, and technology in social work is real, it's meaningful. We all live digital lives, and it's about time that we also have digital services. So I think it's important that we maybe step back and ask ourselves as we go forward as a profession in terms of tech, who decides and how are we going to use it? And I think all of us here today play a really key role in about how we maximize the use of technology within social work and social care. And there are a huge amount of benefits to using tech, and I'll come on to some of those. There are also some risks too, so we also really need to think carefully about how we navigate these spaces. But I think you, I, and everyone else, we know how we want to live our digital lives outside of work. But I think we need to reflect that a bit more into our practices and think about the people that we support and how they want to access the world, and how do we make that possible through our practice and our innovations within practice too. I think it goes without saying that the pandemic was a great accelerator for technology use within social work. Before COVID-19, I think we'd started to engage with digital practice, but it tended to be more that focus on e-professionalism, about the ethics of using social media, being a bit scared about what happens to me with my SSC registration if I'm on Facebook and someone contacts me. But we were forced into using platforms to directly communicate with people in the pandemic. And I think it really showed the need for us to build effective services that are resilient and can really stand up to anything. But we need to ensure that our social work values and principles are at the heart of this new way of practicing. And I think perhaps maybe the pandemic forced us to engage in a way where we didn't have much time to reflect and stop, and it might have felt artificial at times. But I think now really it's important that we do it with a bit more thought and a bit more consideration. Um, we do need to understand the ways in which people are using digital, and we need to think about how digital spans across the lifespan of people that uses our services, and it touches upon all key areas of social work, thinking about adults, justice, children and families. I think children and families is a really good example because our young people are growing up in that virtual world, the metaverse, as you sometimes hear it being referred to, and they tell us that they want to engage with their professionals digitally. And I think we as social workers need to be alongside these people and help really embrace digital. Calum, if you go to the next slide, please. Thank you. But before we look to the future, although it's kind of the now, I think it's important that we look back, and I'll just give you a very, very quick short history lesson. There's a really fantastic social work academic called Amanda Taylor Beswick, who's at the University of Cumbria, and she writes a lot about the use of digital within social work practice. And if anyone's been to the Social Work Scotland conference Amanda presented last year, I'm a very, very big fan of her work. And Amanda talks about the relationship between social work and technology and how that goes back over 100 years. It's actually 106 years to be exact. And the earliest references of technology in social work were from 1917. An American social work professional, Mary Richmond, who, along with Jane Addams, for those that did their social work training at university, is regarded as one of the mothers of professional social work practice. And it was Mary who recognised the value of using the telephone and actually began to encourage social workers to exploit the telephone as a practice tool. And Mary, in her writing, actually talks about the resistance that she received from the social work sector initially when she made this suggestion about using a telephone. And I suppose I want you to stop and think now, can you imagine what a social worker would do or say if you told them that they couldn't use a telephone? You know, what would we do without our mobile phones these days? And we've seen countless innovations in social work practice which have failed because they haven't necessarily aligned with the values and principles of social work. And I'm sure you can probably think of some your own from your own practice experience in your own area. But no matter what we do with the technology, we need to make sure that it's underpinned by the values and principles of our profession. And we need to make sure that we're using technology in a way that is ethical, that it's appropriate, and it won't bring our profession or our registration and our into disrepute, apologies. And we need to make sure our professional standards reflect that as well. And I know there's some work going on with the SSSC to update the codes of practice, and I know that there will be a digital lens applied to that too, which is excellent. There has been sporadic use of technology over the years in social work, and research continually reminds us that we need to take the driving seat in this and not be the passenger when it comes to technology. I recently heard about when there's any technological innovation, the military adopt it first, and then the sort of business finance sector then adopt it, then health will adopt it, and somewhere at the very end are us in social work and social care kind of feasting on the scraps. And I think we need to start making sure that we're at the forefront of these discussions, which is why it's great to be here today. Callum, next slide, please. So I think it's a really important question to ask, why has social work been slow to adapt? And as I said, too often it's felt like we've been on the back foot from a tech standpoint compared to colleagues, even in the NHS and in the third and independent sector, I must say. I don't know if we might have people here from Scottish Care today, but I know they've done some fantastic innovative work. Social work, as we all know, is a value-bound, person-centred, right-based, solution-focused profession, really with the purpose to empower people. We see that reflected in our policy, our strategy, our legislation, Self-Directed Sport Act, for example. We're taught that at universities, it's in our job descriptions, in all of our practice experiences, you'll see that reflected. Social work is all about people, there's no getting away from that. But we as a profession are becoming more and more increasingly burdened. We're understaffed, we're overstressed, we're too often bound by admin and bureaucracy. We feel that we're chained to our desks, mountains of paperwork. I know, I've been there, I've felt it, I've done it. And we're really getting to make those meaningful connections with people, which are so core to our job. And also, if we're honest, the reason why we all got into this line of work. And anything that takes us away from people, thinking about the admin and the bureaucracy, is often seen as a burden. It's not my job, it's not my problem. It's not overstatement to say that social work is an anti-establishment leaning profession. And if we cannot see the benefit to us or the people we support of using any bit of innovation, such as digital, we're not going to embrace it. Not if it involves us going against the grain and risk of kind of losing sight of who we are or what we do. And I think, unfortunately, technology in social work has long been associated perhaps with the managerial tools or case management systems, which can often categorize people into ways that we're not particularly comfortable with. And I think what's worse is that often the technology we've had within social work is clunky, it's slow, it's unreliable, it's out of date. It feels like it's only been in the last 5 years, for example, that smartphones have suddenly become universal in social work rather than those cheap burner type Nokia phones, the plasticky things that we all had. I mean, I distinctly remember when I first started in as a social worker in Edinburgh Council just about 10 plus years ago. I heard that colleagues in Glasgow were starting to get iPhones and feeling deeply jealous that if I went and worked in Glasgow, I might get an iPhone because this plasticky thing I had was completely useless. But we also know now that the tech that we have in social work or have used in social work hasn't been implemented properly. It was done to us rather than with us. And implementation science, a little shout out to Jane Kellock, tells us if we do not receive the right training and support to help us understand how and why something is happening, we're not likely to embrace it. I mean, only as I say at the start of my social work career 10 years ago, I was still requesting those giant paper files. I had my little burner phone that could make calls, just about send texts. And we were sent on training to learn how to use our brand new shiny case management system. And I worked with social work colleagues who'd been in the profession for 30 plus years, fantastic social workers, but tech and digital capabilities was something that they weren't comfortable with. And I had one poor Margaret, I hope she doesn't mind me picking on her, she'll never find out, but Margaret struggled to even attach documents to emails. So then her being expected to use a fairly complicated new case management system after just one day of training, I think you can imagine that it really sent her and a few other colleagues into meltdown, even threatening to quit at some points because it wasn't something that was natural to them and it hadn't been implemented properly. It had been forced upon us. Calum, if you go to the next slide, please. Thank you. But why use technology in social work? I think there are huge amounts of reports, pieces of research that highlight that social work must embrace digital practice. While I think this is important, while computers, electronic devices, digital technology might at times feel like the antithesis of the care and individual human interaction, which is so at the heart and the core of what we do as social workers. Digital issues greatly affect today's society. You only have to look at the news to see that, particularly children and young people, but that's also true for older people as well. And social work owes it to itself and to the people who use our services to keep up with digital developments, to ensure that we as a profession are future proofed and we're agile enough and flexible enough to meet the needs of digitalized citizens so they can get the best and what they need from social work in a way that suits them best. I'd like to introduce you to Jordan, is on the screen there on the right hand side. Jordan is a care leaver advisor on the BASWA, the British Association of Social Work Digital Capabilities Project. And that was a project looking at how we best prepare social workers to be digital. Don't worry, I've got a whole load of resources and links, which I'll share once I finish my presentation. And this work is included in that too. But Jordan's message is very clear. Jordan says, we are digital. Our lives are digital. We bank, shop, interact, socialize online. There's no longer a difference between the digital world and in real life. And Jordan actually explains really well that he feels he has a much better relationship with his social worker because digital allowed him to have the relationship that he wanted on his terms that best suit his life and his needs. He talks about how the social worker was able to fit around him rather than him having to fit around the social worker, and he wasn't having to take a chunk of time out of his day to travel to meet a social worker, missing work, missing college, having to pay for travel passes just by using video calls. That was all it was. That was the innovation. And I think when we think about the promise and some of the recommendations within that, we can see how digital could really help. And I know I've said it before, but we do live in a digital culture. We all do. We WhatsApp friends, we FaceTime family, we use Microsoft Teams as we are right now to do our job. And more of our services, and I mean our services in general, not just social work and social care, are becoming digital by default. We have a we've adapted out of necessity, but we also need to meet people where they are. And we know that many people want and expect to use digital tools for support. And I think it's important to remember that the communities of the 21st century are really quite different to those that we had in the 80s and 90s. People are forming really meaningful communities online. I say this as a social worker who previously supported a national online community for male carers through Facebook, actually. Need to be there as much online to support those communities as we are in person. Next slide, Callum, please. Thank you. I'm happy to report that use of technology and digital in social work and social care has improved the profession. We've got a lot of evidence that shows that we've got less paperwork, making us more GDPR compliant. We have fewer delays. We've got improved efficiency, better records management, safer information storage. No longer are people leaving paper files on buses. We're more proactive and preventative in our care, and we're seeing less time and money wasted as well. We've got less need for staff to travel, meaning we're more environmentally friendly too. We deal with change all the time within social work and social care, particularly in relation to the people we support. But I think if we're maybe honest with ourselves, we don't like too much change in our own jobs. But I think we underestimate our ability to adapt, and we wouldn't now be without the tech that we originally resisted. But that's not to say that we don't have a long way to go still. Next slide, please, Callum. Digital social work and technology within social work and social care offers many benefits and opportunities, but digital social work just isn't about the process. And while it does help us fulfill some of those organizational dimensions of social work practice, that case recording, the data capturing, the sharing documents, and that is fantastic. That saves a lot of time. I don't want to take away from that because I think that's really important. But we can and should be using technology to improve our practice. We still see social workers double or triple typing case notes into systems. It was only a few years ago I was a hospital-based social worker, and I literally had two separate computers. I had my social work computer and my NHS computer, and neither were allowed to talk to each other. And if I dared share any information from one to the other, someone from IT appeared and slapped me across the wrists. And I'm often perplexed why we aren't using voice to text technology for case recording, for example. I don't know if you do it yourself, but if I'm feeling particularly lazy, I'll write my text messages to friends and family just using my voice, using Siri. I think we could be using that sort of technology for case recording as well. But, and importantly, we need to think about digital technology as an enabler to help us achieve those core social work objectives. So thinking about inclusion and co-production, our assessments of support planning processes, our reviews, our case conferences, I'll come on to that a little bit more in a second. It can really support and empower people to have more choice and control, thinking about self-directed support. It can support self-determination, service provision as well. In many ways, it supports equality. In some ways, not. And again, we'll touch on that in a second. It can also support professionalism, safeguarding work, and relationship-based practice as well, because it allows us to initiate, maintain, and enhance those relationships. I often talk about that video call in anticipation of that home visit, that initial home visit, I should say, to build that relationship before you've even stepped over that door, and maybe ask some dignity-based questions about, are you okay if I wear my lanyard that says social worker? Are you okay if I park the pool car that says City of Edinburgh Council outside your house? And these are things that I see them as little tokens in the relationship box to help build that up with a person before you step foot over their door. We often talk about the workforce crisis in social work, and we don't have enough social workers to meet the demands of the workload. We also hear about our winter pressures, which I think, if we're honest with ourselves, are now just all year round pressures. And for me, if we cannot increase the workforce, then we need to look at ways of decreasing the workload, or at least slowing down the day-to-day demands. And I think digital is a really good method to do that. Next slide, please, Callum. Just as a reminder, I've called this slide self-directed digital support. So just as a reminder, I've taken the self-directed support values and principles as set out in the legislation, just to try and make it relevant to what we're here to talk about, as well as some of the most relevant SDS standards, which you can see on the right-hand side. And I think if you read across these, it's not too difficult to start thinking about the role that digital could have in supporting some of these or helping us maintain some of this. Digital can offer more options. As I said, it can increase choice and control control, promote autonomy, occlusion. It can overcome rurality and isolation and connect people with services that might not have been available locally. Thinking particularly about some of our more rural Highland and Island communities, or some of the Scottish borders as well. It can be a bit harder for people to travel to services, or for social workers to take in hours out of their day just to do one home visit. Digital can also create more transparency. It can involve people better in the assessment and support planning process. It's crucial to helping us improve communication and how we record case notes and plans and assessments. And really, it can help practitioners to work a bit more autonomously and allow for that more proactive and preventative service provision. And let's not forget, and I've highlighted it on the screen there, that one of the principles of self-directed support is innovation. And this is what we're talking about. We're talking about doing things just a little bit differently in order to better meet people's needs. Next slide, please, Callum. And I'm just going to quickly check on my timings. I'm okay. I've popped up there the person's pathway for self-directed support. I'm sure this is very familiar to many of you. You've seen it 100 times. And while we don't necessarily have time to go through it in detail today, I think there's a really interesting exercise to be done if you looked at each step in this process and considered what a digital innovation or a technological approach could do to support that. So for example, starting at the top, when a person themselves or a family member contacts social work to request support, could this be done online? Could it be done through a mobile app? Can a person speak to a first contact centre or a duty social worker through a live chat facility? Could it be a video call? We're already seeing some developments in these areas in Scotland. We've got the digital front door developments kicking off, and I'll talk a bit more about that in a second. And I know that there's some areas in Scotland, and hopefully there's some here today, who are starting to digitise their first contact centres. Glasgow, for example, have done that, and I know there's a couple of areas who have also done that. But I think it's important to ask, is there a more consistent and SDS friendly approach to this? I just want to kind of pop some ideas in your head, I suppose. Then if we moved on to the assessment and support planning process, can digital support better co-production? I know I've mentioned that a couple of times. Can we sit with a person with a tablet and complete that assessment or that support plan together? Can a person easily access their assessment or the support plan? Can we record their voice into that support plan and they can embed their views? Can a practitioner use that speech to text software to record their notes? I often dream about the idea as a social worker of doing that home visit on a Friday afternoon, getting in my car, recording my case note, using my voice, and knowing that it's uploaded securely to the case management system, and being able to go away and enjoy my weekend without kind of thinking, oh, on Monday morning, I need to make sure I remember to record that. Also, can we use software like the 247 Grid, which I know you've heard about before, to do visual support planning? I think there's some really exciting opportunities, and these things are happening, but we need to be doing it a bit more and a bit better. Even if we move round the pathway onto support itself, does support have to be delivered in person? What technology could be used? Digital telecare is really exciting. There's a lot of developments around that. Alexas, I should probably say that quietly, there is one in this room. Online support groups, they're particularly relevant for our more rural communities as well, where there aren't as many options for service provision. So if you can access something online that isn't available in your area, I think there's great advantages to that. And of course, reviews as well, online reviews. Now, I add that in with a bit of caution because I recently met with a number of social workers. I presented at the Scottish Government Social Work Policy panel on this very topic, and I got some conflicting reports about online reviews. Actually, I'd had colleagues telling me how beneficial they'd been. There was one social worker who'd just done a review that morning with someone's family who lived in Spain, so they were actually able to be part of that review process, where if they hadn't been online, they wouldn't. It also stopped social workers and family members and supported people having to travel here, there, and everywhere. Um, it's about fitting better into people's lives, taking us back to what Jordan was saying in that earlier slide. But I've also heard social workers starting to say that they've been told it's business as usual again with reviews. Online reviews are a thing of the past. They were things only done in the pandemic. We need to be face to face again. And I just want to flag that up as that's a bit that unsettles me a little bit. And hopefully that isn't happening everywhere, because we should always have that as an option. Digital is another tool in a social worker's toolbox. But as it says on the screen there, technological innovation in social work and social care must support a person's outcomes and not distract from it. A piece of software or an app is not the innovation. It's how we use that in practice that's truly innovative. And I hope you take that away today and remember that, because that's something that I heard recently and it really landed with me. Calum, if you could just pop to the next slide, please. This is just a quote that I wanted to put up to remind us that it's about people, not the technology, like I just sort of said. I think the quote speaks for itself. Technology and digitization should be for the betterment of people and communities, not just about more effective admin, but it can really help with admin too. Digital is not an end in itself. More interactive services that promote choice, autonomy, and inclusion is the end, and we can't forget that. Next slide, please, Callum. But it's also important that I point out that the digital world is not a level playing field. It's only for some people in some places. Much more work is needed to make it more inclusive. We must digitize with care. Many groups of people are left at risk of being left out of our services as we become more and more digital. So we need to make sure that it benefits everyone and that nobody's left behind. This includes vulnerable groups and those with poor digital skills or those without the right technology or the right connection. And it's also important that our face-to-face services are on offer as well as online. It's a person has a choice and they've got an option to do a video call or a home visit. It's about what best meets their needs and also can flexibly meet the how the social worker, what their kind of schedule looks like too. But if we cannot participate or included or be included in the digital world, we are going to miss out on the advantages of living in a digital society, and the services that people can access. The World Health Organization have actually recognized that digital exclusion is a social determinant of health. Therefore, we can assert that healthy communities need to be connected communities. Callum, next slide, please. Um, I just wanted to pop this in just to make maybe as a point of reflection, but it's important to ask, are we ready? Looking at the use of technology and digital and social work practice more broadly, I think it's safe to say that we've been merely muddling through. We've been making do with what we have, but we need to ask ourselves, are we content in muddling through? Surely we want better and we want to be taking the lead in making things better. That's what we do as social workers all the time. We need to be more structured, explicit, and intentional with how we embrace digital and social work to stop muddling through further. And that's why it's so great to be here to be helping you have that conversation today. And I think the question we must ask ourselves is, how prepared are we to practice in the world of technological potentials and technological perils? There's no getting away from that. Is our training and education preparing us to use digital technology in our practice? What about the inductions that we undertake when we start new roles? Do our staff have the right skills? And crucially, do they have the right technology? Next slide, Callum, please. The future for me is hybrid. Technology and digital tools in social work and social care have been an unfulfilled promise for a really long time, but we can no longer avoid digital and technology in social work. It was always coming and COVID has just accelerated that, but we now need to make sure that we have a seat at the table and really influence the position of technology in social work, and we co-design fit for purpose tech that meets the needs of people that use our services and meet our needs as practitioners as well. Digital practice should not be regarded as a last resort. Technology and digital are now an inevitable and necessary element of social work practice. Hybrid working offers us much more flexibility, and I don't think we would want to go back to how things used to be, although I've heard a little bit of creep there, as I said before. I think it would actually be really harmful for our profession and to those who we support if we were to go back to business as before. And I think hybrid practice is best understood as integrating those digital practices with our face-to-face interactions. So it is that video call in anticipation of that home visit, like I explained before. And I think moving forward, it's really important that we consider hybrid digital social work practice to be a future-ready element of practice. It's designed to accommodate the uncertainties as they arise and is sensitive to the improvisory nature of social work practice. Social work is a rights-based practice that I said at the start. It's about empowering people, and times are changing. People are living digital lives. It is time we put our misgivings about technology aside and no longer see it as something that is unhelpful, and we maybe reposition ourselves to see it as a safe and efficient process that actually wraps around a person. It's part of their lives already. It's part of our jobs. So used right, it can really help us to work more smartly and allow us to have more time with people as well, and use our skills and energy with them rather than our skills and energy to feed the machine. Um, and if we don't risk the change, then unfortunately we risk the profession losing credibility and really fading into the background, which would be disastrous. We all know that social work is critical to. Wait, sorry. lost my note there. We all know that it's critical that we future-proof our profession, and we need to get on board with technology in social work. So with that being said, Callum, next slide, please. What is the current landscape? On the screen there, you can see two joint documents that were published between Scottish Government and COSLA. On the left-hand side, in October 2021, Scottish Government and COSLA jointly published Scotland's Digital Health and Care Strategy, called Care in the Digital Age. And in November 2022, they published Care in the Digital Age, a delivery plan, which is on the right-hand side there. And don't worry, I'll share the links to these afterwards as well. The vision is to improve care and well-being of people in Scotland by making best use of digital technology in the design and delivery of our services. And in order to achieve these aims and ultimately the vision, Scottish Government and COSLA are focusing on 6 priority areas. These are digital access, digital services, digital foundations, digital skills and leadership, digital futures, and data-driven services and insight. And then when you look at the strategy and the delivery plan, you'll see a number of areas of work that's ongoing underneath that, some really exciting work. And if we go into the next slide, please, Callum, I'll give you a very quick flavour of a little bit of some of that, but I really would encourage you to go away and have a look at the strategy and the plan yourself. In my job, I'm very fortunate to be involved in many of these areas or hear about them or speak to people that are doing it. We've got our data strategy for health and social care that was published in February this year, and that's got the aim of helping people, how people can control and access their own data and how we can harness that data into better care delivery. We've got digital front door developments, which are really starting to kick up steam, and that's about how we support the citizens of Scotland to access a wide range of self-served health and social care options online via an app. It will allow people to access services and their information directly. Near me in social work, we've seen some of that being used during the pandemic, both in the care home reviews, and there was the duty social work pilot as well. I know of one area, one health and social care partnership that's currently rolling out near me across all of adult services. I caught up with them yesterday actually, and it sounds really exciting how things are going, but we could be using near me better. And I think we could be using near me in areas of social work where it's maybe not been used before, such as children's services or prison-based social work. And I've got something bubbling away in the background potentially to do that too, a proposal to have some money to try and test that out, but it's currently lost in budget limbo at the minute. Digital telecare is another really exciting one as well. We're seeing more and more use of proactive and preventative telecare that actually enables us to check in on people. Well-being calls are made. There are sensors in homes that analyze a person's pattern. It sounds a bit Big Brother, it's not, I promise. And when a person falls out with that pattern, so if they have their lunch every day at 12, if they go to the toilet every day at 1, if they have a nap for a couple of hours, the system begins to generate a picture on a person, and when they fall out with that pattern, a phone call is just initiated and someone says, Mrs. Jones, are you okay? I just wanted to check on you. And there's been huge both financial savings but real improvements within people's life and their independence through that. And there's a great learning report which has just been released a couple of weeks ago, which I will make sure shared with you too. We've seen use of Microsoft 365 as well, connecting health, social work and social care professionals, people actually being able to speak to each other, access calendars, share documents securely, which is really important. That's being tested particularly in the west of Scotland at the minute. It has been held up a little bit in data protection agreements, but I think the more and more that we use technology such as that, the advantages are huge, that we could speak directly to police, social work, health, education online without having to go through all the formal channels would really just make things a lot better. We're also seeing great developments around digital skills and leadership training. There's a master's in digital health and care that kicked off this year. There's also the digital leadership program, which I'm a current member of, and there is applications open at the minute. I think they close in July. So if anyone is particularly interested in developing their digital skills in terms of leadership and increasing their knowledge around that, then I'd be happy to share the links with that too. Just last week, I actually heard about culturally competent robots that are being used in care homes in England. They're interacting and socializing with residents, asking them questions about their lives and who they are, and that's seen a real significant decrease in feelings of loneliness. And AI as well. ChatGPT is something you've probably heard a lot of in the news and people not really sure what it is. I think that's going to be another game changer when it comes to social work. It's already ingrained in many aspects of our lives, you know, when you're banking and things like that. And it's only really a matter of time before it makes its way to social services. I think we've got a long way to go and we need to learn where the guardrails are in terms of AI, but it could really revolutionize the way that we do things. Just last week, I actually saw an example from England of AI triaging referrals. Particularly, they were child protection referrals and making sure that they were recorded properly on the system. They were actioned to the right people, and it was actually able to evidence that what would have taken a human 15 minutes to do per referral was taking the system 1 minute to do. Obviously, it's only as good as the programming that goes into it, and these systems can be a bit biased, but that's another reason why we need to be at the forefront and getting our sleeves rolled up and get in and about it now. I also heard of some really exciting work where colleagues are using virtual reality in Scotland to help staff better understand the impact of trauma or what it's like to have dementia or autism. I've also heard there's an app that for tablets that uses facial recognition software to assess for pain, the Pain Check app. So there's a lot of really exciting opportunities in Scotland and in the UK and in Europe, and it's only growing. So I think the more we can learn from others and start to look at what we could do in our area is really exciting. Next slide, please, Callum. I will wrap up very soon and we can have a bit of time for questions. But I do want to say that successful digital practice needs to be thoughtful and planned. Don't feel alone. Don't feel that you're stranded out there in a digital world. There are a growing numbers of tools and resources to support and develop digital practice. I've highlighted a couple on the screen, but don't worry, I've got a list I've compiled of all of these with resources and links, which I'll make sure is shared following this presentation with everyone who's attended. But just to say that you aren't alone, there's a lot of support there, and I'm always here for a conversation as well. Next slide, please, Callum. And this is my final slide, actually. I was actually very fortunate last week to attend the European Social Services Conference in Malmo in Sweden. And the theme was actually on the use of technology and innovation in social services to promote autonomy and inclusion. So perfect timing that I'm here today talking to you all. Present were nearly 700 delegates from 40 countries all over the world who were sharing their learning and practice experiences. And I'm happy to report that everyone is still kind of muddling through and trying their best. Some areas are making great innovation over here, some over here. A lot of people saying to me, oh, Scotland do things really, really well. We're excited to see what Scotland are up to. And I'm sort of going, okay, give us a bit of time, please. But over and over again, I heard colleagues talk about how they felt propelled to do something different. They needed to be innovative. They needed to think out the box because the system as it was just isn't working. And we don't want to just do things as we've always done it. We need to make sure that it's right. On the screen, I've popped up a quote that I loved I heard from Ann-Sophie Martinsson last week when I was in Sweden, and she's the manager of the Connected Society unit in the research for the Research Institute of Sweden. And Ann-Sophie said, as you can see, big challenges demand a lack of respect for how we've always done things. When you focus too much on risk and limitations, even the possible becomes impossible. We know that the current system isn't working. It's not meeting the needs of people who use services. Self-direct support implementation hasn't been great, as we all know. This will only increase as our citizens become more and more digital in every aspect of their lives. We need to keep up or we risk being left behind. And that's not a place we want to be. So if I could leave you with one takeaway message, it's that it's no longer about whether we do digital or not in social work and social care. It's about how we do it. So join me in becoming a digital disruptor. Next slide, please, Callum, which is just to say thank you for listening. My contact details are on the screen. As I say, I'm always keen to have a conversation, and any questions I'd be happy to field. And yeah, let's just keep the conversation going.
Fantastic, Calum. Thank you so much. And everybody will have your contact details and be in touch. And it's really exciting. We've had lots of examples of practice in the chat from independent support organisations, from Simon Community, from voluntary sector, and also from local authorities. There's been talk about doing reviews online. Making sure that choice is crucial, so people having the choice, an understanding of risk. And there was a question about near me, where else it's being done from our colleagues in Dumfries and Galloway. So obviously Calum will have access to all of that chat and be able to get back to you, and we'll make sure the presentation is available to everyone. We've just got a couple of minutes for